So let me go ahead and share my screen here. And let's see here. We'll minimize this. Okay. This is called Vision X. It's our software. Layout looks very familiar, right? You get the panoramic image, and you have the 3D volume here, axial view here, cross-section view here. So that's standard. What we do different is that panoramic curve is automatically detected for you and drawn out for you. It's all adjusted for you, I should say. And the nerve is already mapped out using AI, but we don't tell clinicians, we don't tell people that that is 100% accurate. So we always want to give a starting point, but we want the clinician to review it. Let me show you how that works real quick.
You can adjust that then.
Yeah,
Is
let me
that right?
show you. Yeah, you could adjust it. So first off, the panoramic curve, instead of drawing it or moving that curve, what we could do is click on this. We call it clear pan. What it does goes through the volume and creates a panel for you, and you could
Okay.
adjust the width here if you like. Okay, and then the nerve is mapped using AI. It goes through the full volume, and then it asks you to check it, verify it. And of course, we do that in the cross-sectional views here, and we could look at that as well. So it gives you a good starting point. That's done during reconstruction, by the way. It's not something you have to click on. It's just this is the first screen you would look at.
Awesome.
In these views here, we have the transversal slicing views. So these are three views. This is the panorama view where we start. This is the transversal slicing acquisition view, and this is the MPR view. So these are the three
Okay.
views. And
Cool.
navigation is just like you're used to in the axial, coronal, sagittal views, right?
Yep.
Those are all the same. And what I would like to do, if you're comfortable with it, I'll just give you full control and you can move it around. Would you like to do that, or you want to just tell me how you want to navigate? What would you like to do?
No, yeah, let's go for it. Let's play with it.
Okay, so I'm giving you full control right now. Can you
Okay,
move?
let's hope it'll work.
Is it? It's real life. There you go.
Uh,
Okay, so if you don't mind, talk me through this. What are you looking at? What's going on in your head when you're looking at a scan for the first time?
so the first thing that I'm gonna look at, I want to make sure there's no motion. So
Okay.
that's super important. So let's go ahead. We're gonna move right to the midline right here.
Okay.
And we're going to check our cortical borders. And if you had the cervical spine, we would check that as well. So usually if you go right to the sagittal sections and you look right in the midline,
Okay.
if you have double cortical borders, then you know you'd have motion artifacts. Or if you see multiple streaks in your axial sections or your coronal sections, then we know we most likely have motion artifacts. And the sagittal typically confirms that. So this is a great scan. We don't have any motion.
Okay.
Now, can we reorient the patient? Is that possible on this one? I
Yeah,
mean, this
how
patient's oriented perfectly, but typically, if the patient is not oriented in a symmetrical fashion, we'll go ahead and reorient that patient also.
so
So there's a look
when
at.
you say that we could actually click on the view and rotate it. Is that what you're asking about?
Yeah,
Yeah,
can
let
you
me
click on?
let me do that. If you go here in the corner, you
Oh, I
could
see.
rotate it like this.
Ah, there you go. Perfect. Oh, maybe I might. Okay, so it's you said, can I bring down the sagittal, or is it just the axial that rotates?
They all rotate
Okay.
like this.
Oh, I see. Bring
And
him
then the
down.
sagittal over here,
Yes, I would bring him down just a little bit.
chin down like that.
Chin down just a little bit.
More.
Yeah.
Okay.
Perfect. Right
You,
there. Right
okay.
there's perfect.
Okay. Let me give you.
Okay. So that kind of makes it a little bit wonky here, but you're going to have like some really nice symmetry. And then when you go to do your panoramic reconstruction as well, then you have that nice smile line. So those are the things that I typically look at
Okay.
when I'm just setting up my case.